Follow us from start to finish with a patient using our CAD/CAM dental technology. At this point, the patient is already numb if needed, and we are organized and ready to go. Dr. Salata will prepare the tooth for the crown or restoration. This allows us to make a secure, adequate structure for the crown to be placed on. During this time, we keep the patient as comfortable as possible and allow them breaks to rest their jaw. It takes about 45 minutes to get the tooth ready for the next step. At this point, Dr. Salata will spray a powder on the tooth, which allows the camera to capture the image. Here the camera is placed over the teeth and emits a blue light. Then the camera automatically takes the picture of the tooth receiving the restoration, as well as the neighboring teeth and gum. Then the computer takes the different pictures and combines them into one three-dimensional model. Next, the doctor will have the patient bite into a soft putty that turns hard. He then also takes pictures of that. The computer will use these pictures to help form the top side or chewing part of the crown. The computer will then combine together all the pictures taken. At this point, Dr. Salata is marking the edge of the tooth. He then instructs the computer to begin the designing of the crown, which you see take place here. At this point, Dr. Salata makes some design adjustments to the crown. He makes sure there is adequate thickness and spacing. The colors indicate how heavy the teeth are hitting, and then we will adjust it. And now comes the next interesting part of the procedure. We select a block of porcelain based on the tooth shade and size, and the computer lines up the crown within the block of porcelain. So now when everything looks good, we instruct the computer to send our exact design to a special milling unit, which will grind the crown out of a block of porcelain. At this point, we have placed the real block of porcelain into our milling unit. It has two burrs, one on each side, and sprays a lot of water to keep the process clean and cool. Here the milling unit is sizing up the block of porcelain and getting ready to start grinding. The water spray begins, and here we go. Since we are fabricating the crown in one visit, there is no need for a temporary crown, return visit, or to get numb again. Patients really love that part. After around 7 or 8 minutes, the milling is complete. We then take the crown back to the patient's tooth and begin to try it in. Some adjusting is necessary to get the proper fit. At this point, we polish the crown to make it smooth. We use floss to make sure the crown is not too tight between the other teeth. When the doctor is satisfied with the fit, we place special chemicals into the inside of the crown to etch the surface, and then bond it to the tooth. Then we use bonding cement to place the crown onto the tooth. And here we use a special light to make the cement set up. We then clean up the extra cement and have a happy patient. The entire procedure usually takes about an hour and a half.